Our Director of Public Health, Dr. Rex Archer, our Director of Emergency Medical Services, Dr. Erica Carney, our City Manager, Acting City Manager, Ernest Rouse, and our Fire Chief, Donna Mays. A few things to note, and I guess to just lead, we've announced a ban on all events of 1,000 persons or more. Those are large events, and those are events. We note that this morning we caught as well that there are 3 additional cases of coronavirus in the metropolitan area. Dr. Archer will spend some time talking about the importance of social distancing between folks to make sure that we're not seeing spread and communication of the disease between folks in some close proximity. And I'll note a few things because we've already received questions relating to it. Where does this apply? This applies to events. The airport is still open. Schools that have 1,000 persons or more are still open. But the types of events that we're looking to prohibit, and indeed that we're banning today, are those of 1,000 persons or more within one space. That would include functions like Planet Comic-Con. That would include sporting events. That would include musicals, theater performances, etc. This will run for a period of 21 days, at the end of which, or slightly before the end of that time, we'll look to reevaluate. We'll see the nature of trends both in Kansas City and nationally in connection with what's going on. We've also announced today at City Hall a ban on all non-essential travel, domestic or international, for city employees. Our goal is to continue to try to contain. We have been in many ways fortunate so far in Kansas City, Missouri, but that does not suggest that we don't need to continue to implement prevention measures and to try to take key and important steps to make sure that we're looking out for the public health of our entire region. A few other notes, and then I'll get out of the way for Dr. Archer. I've been in conversation with several superintendents of schools this morning. This is not an announcement as it relates to what schools are electing to do. They continue to go through their own evaluative processes in the best interest of their school buildings and their school districts. And I know they're talking to each other, particularly the school districts in Kansas City, Missouri, all 14, in connection with what is the best approach for all of them, largely in a unified manner. So that's one thing that's of importance. Another thing I want to note is this. There are some who will be angry about any number of things that will be closed over the next several weeks or perhaps longer. Trust me, we are in the business of collecting tax revenues and that sort of thing, so we don't come to these decisions lightly. But we understand that it's vital that we take an important leadership position on prevention. Even though our city has not seen the same flare-ups that you've seen in places like Seattle and Westchester County, New York, etc., we think it's important that we try to make sure we avoid those problems. We think the steps that we're taking today will buy important time for our public health, public safety infrastructure. We think that it will allow us to make sure that we're able to be prepared for any challenges in the future. And frankly, we think this is necessary to keep our community safe. Everything we've said before continues, right? If you're persons in at-risk groups, if you're some who have been subject to illnesses before, if you're folks who are of an older age, we continue to encourage you to take as many steps as necessary to protect yourself. And importantly, and something I said the other day, if you're somebody who is not in one of those groups, it's important that you follow many of the guidelines that we've announced today, making sure you're following good hygiene, social distancing, etc. Everybody has a role in making our community safe, and we think this step is important for us in connection with that. I'll be followed by Dr. Archer, then Dr. Carney, and then we'll be available, myself, the city manager, and both physicians for any questions. Dr. Archer.
Thank you, Mayor. So the actions that we're taking today are a small part of how you stop these types of outbreaks. I want to emphasize that. There's a huge amount of personal responsibility, as mentioned, stopping handshakes, not even doing fist bumps because you can still see bacteria and viruses transmitted that way. We're even moving a little bit away from the elbow bump because that's actually where we're telling people to be sneezing. So think about, just greeting people with a hand over the heart or the namaste. We need to break this cycle to keep this virus from moving around. The other part that I want to really emphasize is these measures will help some, but for those that are high risk, and high risk is defined as anyone over 60, anyone that has heart disease, lung challenges, immune problems, you need to be thinking seriously about, would you even be in a room like this right now? Once we start seeing person-to-person transmission in the Kansas City metro area, we wouldn't have a meeting like this. We wouldn't have you in this close together. When we had a meeting at the chamber, we started separating things out. Dr. Carney and I will kind of demonstrate you need to be far enough apart that you can't touch hands, and there's some space in between. So if we're queuing up in lines for whatever it might be, elections or anything else, keeping some distance is important right now. If you're over 70 and you have any of these pre-existing conditions, I'm basically telling you as a city physician, you really need to be careful about this. Don't go to conference rooms or that. It doesn't have to be a 1,000-person event. It can be 25 people in a room of this size that is starting to put you at risk. Also, we are working with our nursing homes. Most of them are already taking strong actions. People should not be visiting folks in nursing homes right now, particularly once this starts taking off. Let's see, what else did I want to mention? I think we'll wait till questions then. Dr. Carney?
Thank you, Mayor and Dr. Archer. What we would like to emphasize is that the best form of defense that we have against a virus is prevention. Social distancing is the best thing that we can do. As of this time, no cure exists for certain viruses. The best thing that we can do is be preventative in this. So I agree with what the mayor and both Dr. Archer have stated this morning. For our existing healthcare infrastructures, now is the time to be prepared and have those conversations. If you're already struggling with the flu and RSV, if you are already at high volume or high capacity, start discussing what are you going to do if you start getting COVID patients and how you are going to take care of those patients. A specific example of agency discussions is here at our fire department, Fire Chief Donna Mays, who is already having the discussions on how this will affect our pre-hospital personnel. If you guys do have any specific questions, like Dr. Archer said, we can address those at the end of this.
We'll get to questions in one moment. A few things that I also wanted to make sure I noted, and then we'll get to our questions. One, our public transit systems stay open, both Ride KC, the KC streetcar, they continue to remain open. Of course, you want to use all of the same measures we've talked about, social distancing, good hygiene, etc. I know both the streetcar authority and our bus system are cleaning their cars often, and so we'll continue to do that. As I noted before, the airport remains open, and so you needn't call to check from them in connection with that. We've also received some questions from private businesses, et cetera. If you work in a large office tower in excess of 1,000 persons, of course, this order doesn't impact them unless, of course, they have some giant event on the ground floor. One other point that I wanted to make is this. I know that there are a lot of people that are concerned, that are scared. Really what we're trying to do now is have an important preventative step. And that's what this is all about. We're not trying to be alarmist. We're not trying to concern folks. What we're trying to say is how can we make sure that we don't see a significant impact before we can handle it here in Kansas City. And so that's why we believe we're looking to larger events, 1,000 or more. That's why we're looking to at least this 21-day period, and then we'll see review. There may be some questions relating to how do you come to that number. And largely what we wanted to say was this is about at least the large events for now. If it becomes necessary that we need to look at numbers at a lower number, 500, 250, then we'll evaluate that at the time. But we view, in the interest of public safety now, that our large event number was more important for us to hit and to address a lot of those events, particularly given the number of people that travel coming into some of the bigger events that we might see in our community. So with that, I want to say thank you all for being here, and we welcome any questions.
Mayor, why didn't you do this yesterday before the first game of the Big 12 tournament?
You know, yesterday and the days before, we had a conversation, myself, Drs. Carney, Dr. Archer, about public health issues, public health concerns. I think we've seen a lot change even in the last 24 hours. We've seen more health departments around the country, more orders issued from mayors, governors, et cetera, even in the last day after our press conference at 7 a.m. yesterday that spoke to these issues, that spoke to containment. And so I think we were able to evaluate, actually yesterday afternoon, what was the important next step for Kansas City, and we think that this is the best step for us.
Lucas, in this state of emergency, there's a bunch of things that it says that you can do that you haven't necessarily ordered yet.
Yes.
Such as order evacuations, close businesses, gas stations, liquor stores, and anything else that you need to do to protect life and property. What is the likelihood that you will go beyond this step today?
And on that one, we are not certain yet. We wanted to make sure that the full parameters of what's allowed in the charter and our code of ordinances were clear for folks. I think, frankly, what we're trying to do is give some good guidance as well. In the last 24 hours in particular, we've received lots of calls from organizations, festivals, businesses, parade folks, schools, about what we can do, what will happen. What we're trying to say now is, at least for the next 21 days, this is where we're seeing activities that need to be curtailed. To the extent that there is more necessary, we certainly will evaluate that. I've probably seen Dr. Archer and Dr. Carney almost every day, it feels like, and I imagine it will continue to be that long term. I'll make one other note. The city manager referenced this morning. He is in constant contact with our department directors, all of them, to make sure that, first of all, we're protecting our city workforce, but also the people of Kansas City, making sure that we have consistent communication and responses to all of these issues.
Does this apply to churches that might have a congregation above 1,000 on a Sunday morning?
So I've actually talked to a few pastors already since this time as well. 1,000 is generally larger events. It's our view that there aren't that many churches that usually have an assembly of 1,000 people or more in the morning. But this does speak to all events over 1,000 persons. And so some of this will continue to be, as the doctors note, self-responsibility. And I would think that if you run an organization, frankly, if you run an organization outside of Kansas City, and I include in that some jurisdictions that themselves have large arenas and stadiums, I think it's important for everyone to evaluate whether this is a time that we should be encouraging large events, which we would discourage, or if you should say perhaps there are smaller groups, maybe this isn't the time for our bigger events, our bigger travel events, etc. And so we would actually think that this order, it technically applies to only so many folks, but we hope more people actually listen to the spirit of it.
So it does apply to churches?
You said in the tone of your comment here, it seemed to be when, not if, once we start seeing.
Absolutely.
You know on that?
Most of the best public health experts across the country that I've been in contact with will figure that we'll probably have 60 to 80% of the population in this country that will become infected with this virus at some point over the next 2 years. These are measures to slow it down, to make sure that the number of high-risk folks that are becoming infected, and I want to remind people, for 4 out of 5 people, this is an illness that they might miss a few days, rest at home, and heal without any medical care at all. And this is part of the reason of this decision of what day do you make these decisions on. When we cancel these kinds of events, we have a large population in this city that are paycheck to paycheck, that are having trouble making their rent, that are having trouble feeding their kids. And if they can't get this work with these various events, we have other health consequences of these decisions. So that's why we're looking at this for only 21 days to kind of see what is the negative effects of these decisions and occurrences, because they are significant also, and we've got to weigh this. Personal responsibility of not spreading this disease is still the most important part. Now, let's say you have an event for 900 folks. But most of those are going to be high risk. You should be doing the right thing and not having that event anyway. And we'll be looking at this, we'll be evaluating it. We still don't have person-to-person proven transmission in the city. So we're not going to overreact or underreact. We're going to be doing this and monitoring our decisions on a daily basis.
Now, how many people do you estimate have the coronavirus or COVID-19 who are walking around Kansas City today, don't know they have it or have little to no symptoms?
Based on what Seattle and some other places that have done some modeling of this, where they have like 160 a few days ago, and that number continues to change, of presumptive cases that are being confirmed, their modeling shows that if they have 160 of those cases, they probably have way over 1,000 of actual cases in the community. So yes, we have, I believe, cases in the community. Those folks in most cases don't even know that they're ill or can get well just by resting at home. And again, the transmission problem for folks that aren't high risk is not a serious issue right now. It's the high-risk folks that we have to protect. Moratoriums on visiting nursing homes, because if you are asymptomatic, you don't know you're ill, and you take coronavirus into a nursing home, look at all the deaths that we've had in the state of Washington because of that. So this is a slowing down, social distancing kinds of things. If we can change the average number of people that become infected from each person, we can slow it down, and then it won't overrun our emergency rooms, our ICUs, and we will have enough ventilators to treat everybody.
Dr. Archer, you know that Congress and others are talking about additional resources for state and local governments.
Yes.
Can you tell us whether you think you have or we have in Kansas City the resources to deal with what you think may be coming, not just in your office, hospitals, doctors, nurses? I mean, a month from now, are we prepared?
We absolutely need more resources. The risk to Americans is much higher from communicable diseases, whether it's natural or an intentional release, than it is for being attacked by a foreign country. And yet, we'll have 100 times the budget in the Department of Defense, and the Department of what I would call biodefense, which is the CDC, is way underfunded. Well, it all trickles down or doesn't trickle down, and our support here locally, I get 38 cents per person out of the general fund from the state of Missouri for public health purposes. Now, the 9.88 plus million that's supposed to be coming to the state of Missouri, this will help, but we needed this 5 years ago to be able to build all the things that we need to be building. We are building the landing craft after we've already taken off right now.
Dr. Archer, it sounds like you're giving us a conflicting message. Conflicting message in this sense. Don't worry, the risk pool is low, but then 3 minutes ago you said we already have virus cases in the city. Which is it?
It's not a conflicting message from my perspective. Yes, we have cases, but with 2 million folks, if you have 5 or 6 cases or 10 cases or 20 cases, and on average they're only going to infect 2 or 3 people, that's not high risk for folks. It's still much higher that you're going to, die from a motor vehicle crash in the city or other things that we aren't reacting in quite the same way. So that can change, though. If you have a doubling of cases every week, Seattle and state of Washington is talking about if they have 1,000 cases now, in 7 weeks they can have 64,000 cases. So there's a difference between what we're seeing now and what I predict we will be seeing if we're not taking these measures.
Dr. Archer, what are we lacking here in Kansas City? Sorry. You said that we need some extra funding and things like that to deal with this COVID-19 thing that's going on right now. What are we lacking here in Kansas City? What do we need to properly take care of this?
So we're moving forward to adding positions of what we call disease detectives. So just like if you have homicides and you're trying to close a homicide case, if we have an exposure where we have somebody that's positive, how many people were they then exposed to? And then we have to work to find out who those are, figure out what their risk is. Can we then get them into some type of voluntary quarantine or not? So there's a whole bunch of pieces that can start moving up very quickly. Our folks have been working a lot of overtime, even if they're not in overtime eligible positions, to manage what we're doing right now with actually 0 cases, but we're monitoring a number of cases, and those are expanding. Right now, there isn't required monitoring for a lot of these folks that are coming back from countries that have high risk. And we need to be finding ways to do that. We don't have the current staffing. We're trying to work out ways to support all of our universities that are bringing students back. We have folks coming back from other universities in Boston and other places where they're basically closing and saying it's going to be electronic, and they're closing their dorms. So those students that may have been exposed are coming back to Kansas City. So there's a whole bunch of what we call shoe leather epidemiology work that we're struggling with right now. There will be position relief coming, but it's not new to public health. We have TB go up, we get positions, we bring TB down, they take the positions away, we get TB back up. We're in this cycle a lot of times, and we're in that right now. But I have a good, strong team. We have a lot of commitment. That's part of why we're doing these resources. But I'm as much or more worried, how are we going to feed our kids? How are we going to keep our eviction rates from going up as we're dealing with these issues right now?
How many people are you monitoring and how many have been tested?
We're actually not talking about the exact number that we're monitoring because that's a very moving number. Literally, it changes from minute to minute, day to day. We have tested a number of folks, probably less than a dozen right now, and none of those have come back positive.
Can you talk a little bit about quarantine, Dr. Archer?
Yes.
Do you have plans for sort of group quarantine, or some cities have taken hotel? Because we do have some populations for whom quarantine will be difficult, older homes, smaller homes.
We have been talking about that. We are in literally daily contact with most of the other big city health departments, the other 29 of us that are part of the Big Cities Health Coalition that are on the front line of a lot of this activity going on right now. And yes, we have identified the potential of, does the state or do we need to secure a hotel for this kind of work? We've had unfortunate situations where, as an example, a person that may be monitored for potential exposure, and then they have a family member that has an immune deficiency. And so then we've got to deal with, okay, and if that person is not of age, then how are we going to be separating them from that parent? And so we're having these conversations. Luckily, we haven't had to actually do any of that, but we may have to.
That's what I'm asking for. If you feel you have the resources for those kinds of problems and decisions a month from now.
I am comfortable that we will get those resources. We don't have all those right now.
I have a comment as well. So as an emergency medicine physician and an EMS physician here in the region, the most important thing that we can do to help us be ready in a month is protect our 911 services and protect our emergency departments. If you have a mild illness and are otherwise healthy, a lot of this can be done at home. So what we are recommending on the hospital side is that you call your primary care physician before going to your primary care physician's office. So the biggest thing for us, what Dr. Archer was talking about, the infrastructure concerns in regards to ICU beds, ventilators, those will be needed for at-risk populations, older than 60, heart disease, lung disease. So if you are younger than 60 and do not have comorbidities and only have mild symptoms, in lieu of calling 911, what most cities are recommending is that you call your primary care physician instead to help protect those resources. That way we can be ready in a month or so.
Can I ask Mayor? Sure, please.
Are you asking otherwise healthy people to avoid gathering in places like entertainment districts in Westport or Crossroads? Is there a reason to avoid that at this point?
So as Dr. Archer had mentioned, you can have the virus and carry the virus without any symptoms. And so if you have a legitimate concern and or a positive test, we highly recommend that you do not expose others. Because even though you might be okay, the patients at risk and the higher risk populations that we discuss might not be okay. So if you do come into contact with a COVID-19 patient, if you are told by the health department to self-quarantine or isolate at home by the time you become symptomatic, the most important thing you can do as a young individual is protect those at risk.
But if you're not exhibiting symptoms and
She's saying just,
there's no reason to avoid leaving the house.
I think at this point, no. This isn't a mass quarantine of the area that you've seen in Italy, other places. Instead, right now, I think we're suggesting that there is heightened risk at large events. That's how we've seen spread happen in a number of clusters throughout our country, and that's the reason why we're announcing these protocols today. Yes.
We've had zero cases of somebody giving it to another person here in Kansas City. And that can change, and if that changes, some of our recommendations may change. But at this point, there isn't a reason, other than the high-risk groups, to be staying away from these kinds of settings right now.
Could you
Now,
speak over and say that again in front of the microphone so we can all get that on camera? I'm sorry.
as part of that double message that you were talking about, we've had 0 cases of somebody who comes back, imports the disease here, and has spread it to somebody else. We probably will have some of those. We have 0 now at this point in time. So overreacting, shutting down all the different economy issues. Now, if you are a teenager in a home with a bunch of high-risk folks, then maybe you shouldn't be out in some of these venues once we see it starting to take off more in the community. But at this point, we're not seeing that. So our messages will be changing. Luckily, we've got all you to be able to get that message out. I'm surprised you didn't ask about sick leave, because you had a great editorial on that issue, and I published something a couple of years ago about why are we the only country that's advanced, quote unquote, and doesn't have mandatory sick leave, and we need to get that fixed. And so I'm hoping
specifically prohibit cities from enacting paid sick leave policy.
agreed. So we need it at the federal level to overrule that.
It's an interesting conversation. Yes, David.
I just did some quick math. The Royals home opener is 22 days away. Did that play any role in this 21-day window? But have you talked to the team? Because you wouldn't want to cancel the home opener the day before.
Right.
Have you talked to them, or do you anticipate Major League Baseball canceling?
So I talked to a representative from the Kansas City Royals yesterday. As I understand it, they have formed their own coronavirus task force. I know there are extensive conversations with Major League Baseball that I think will impact ultimate decisions being made. I think much like we saw the NCAA, the Big 12 conversation yesterday, I think there will be conversations that baseball is having more broadly. In terms of the question, for 22 days from now, I'm not certain yet. That's why we put a time limit on. There was some discussion, to let you know, as to whether do we want to make this indefinite or do we want to make this some time length. We elected to go with a timed period because we wanted to say to those events that are coming up this weekend, next week, the week that follows, you should not have your event in Kansas City. I think we should give that sort of direction to the folks that are using Bartle Hall, that are planning to go to Fiddler on the Roof, anything under the sun. We think that 3.5 weeks out, 4 weeks out, we'll have enough time to have a conversation and communicate that, whether it be with the Kansas City Royals or any other spring events. But at this point, we are talking a lot, and I imagine well before opening day, we will have an answer as to whether opening day itself will be played in Kansas City or not.
Can you talk about the enforcement of this as well? You know, the Big 12 Carney's canceled as well. Thousands of people in the area downtown.
Yeah.
Are you relying on police to break up groups, or if there's a rally, 10 days from now, how's that all going to work out?
So clearly organic, rallies and congregations that bring people together will be a little bit more difficult to police. But fortunately, we have rules of permitting in Kansas City. We know when most conferences are coming, and we have a record certainly of everybody that's either performing at the music hall or doing an event at Bartle Hall, because those are city-owned facilities. And so this is more of a directive to folks to say that we aren't allowing them. And in terms of how we police it, we have the health department, we have regulated industries, the police department ultimately, the fire department, et cetera, to make sure that we're carrying out these directives for folks.
We have a social media question from a resident. They want to know, can you ask what protections will be afforded to residents who are living paycheck to paycheck and will be forced to miss work as a result of current limits?
So what protections are given to residents who are living paycheck to paycheck? I think in many ways what Dr. Archer mentioned, frankly what we try to do each day in local government to make sure people will be all right is what we're doing in this situation now. That's why the public transportation system's still going. That's why you see us continuing to invest, frankly, in the health department, emergency medical services as well. And so we understand that there will be an economic impact. The first economic impact will largely hit our convention, our tourism industry, at a time where it's not necessarily good for them to be hit. But we understand that that's part of what we're dealing with, but there are a lot of people who work in those industries. We are cognizant of that. In the interest of public health and public safety, we made these decisions, but we're aware of the fact that this may need more support from the city in any number of different areas, and we'll look to that as we proceed, not just over the next several weeks, but over the rest of the year. Are you good?
I'll Congress is looking at some of those relief issues also.
Yes, and the good doctor notes that Congress is looking at those relief issues. We certainly will make sure here at the local government level we address them as well, and we'll talk to everybody in Jefferson City in connection with it. And so with that, we thank you. We'll have probably more opportunities to visit, and appreciate you being here. Thanks.
Thank you.